So I think this is chapter 4 in my saga of papillary thyroid cancer metastatic carcinoma journey that started back in June, surgery August 11th, and an extended hospital stay and several more surgeries. My last chapter was when I got home from the hospital briefly after my first surgery. So this one I'm going to kind of focus on my complications, and hopefully they can help somebody else out there who has similar ones. But during my first surgery, I ended up with a complication, which they knew I had, called a Chyle leak, and that's Chyle. It's a fatty fluid that your lymphatic system has separate from lymphatic fluid. I'm not obviously an expert on that, but that's what I understand. And they saw it leaking, and happens in about 5% of cases, and they made efforts to seal it up then. It's very tricky to seal up and often finds other ways to leak even after sealing. And then put me on a low-fat diet and then a medicine called octreotide, which is a statin injection 3 times a day to help suppress the production of that fluid. They kept me in the hospital several more days as well. So I was in the hospital for 5 nights after my surgery, and then they sent me home. When I got home, the left side of my neck swelled quite a bit, and not ever having the surgery before, I thought that was quite normal. I mean, it was past my ear, and I felt good though. I mean, it was not comfortable having a swollen neck, but I didn't feel sick. It didn't hurt. It was just motion was limited. I got home on Wednesday. I saw the doctor on a Monday, and he was not happy about that. He took me in and did an ultrasound in the room next to where I was originally seeing him, and he saw tons of fluid in there. And he immediately drained it with a syringe, which was sounds unpleasant. I would say it's not my favorite thing, but did not bother me nearly as much as you might think. And in fact, I felt tremendously better after he did that. And he said he wanted to see me the next day to see what I look like. And I felt it filling back up even before we got home. So I knew he wasn't going to be happy the next day, which was a Tuesday. So that Tuesday, he put me back in the hospital, right from his office. His office is right across the street from the hospital, and they started treating me medically again. They tried an NG tube, which is a tube down your nose. They wanted to feed me a zero-fat diet, which is very difficult to do with food. And my gag reflex is just too strong. I couldn't handle that tube, so that tube lasted about 30 seconds. Friday, they decided to operate on me again and clean it out and try to patch up where the Chyle leak was, which they did. And get the drains working again. I had 2 drains. You can see one hole here, and then there's one hole still covered by a Band-Aid. They had really kind of stopped flowing. They had just been overwhelmed by all of this. So they put 2 new drains in, and they started working again. Saturday, things really got exciting. They want these drains draining about 30 milliliters of clear fluid a day before they'll take the drains out. Well, this one drain that came out of this hole was draining 110 milliliters of creamy, milky, fatty fluid an hour. And that's just not good. So the Chyle had stopped coming out where they patched it before and found another way out. And on Sunday morning, he took me back in for what he thought was going to be an hour-long surgery, and turned into about a 5-hour surgery because they found a gusher and took a tremendous amount of time to fix it. And they used just about everything they had except for Flex Seal. And he came out very optimistic. And from that point on, the fluid stayed clear and seemed to really do well, except for Tuesday night when I got a little patch of Chyle, and that really disappointed him and me, and almost precipitated a transfer to Hopkins to get a interventional radiology procedure done that they don't do at the hospital I was at. Luckily, Hopkins couldn't take me right away, and after 2 days, things really cleared up, and I was able to go home on Friday. I really didn't want to go to Hopkins. I felt like I was on the right path with the doctor and what they were doing for me. And I really got very frustrated towards the end at what was happening, just because I wanted to go home. I had been in the hospital 11 days at that point after coming back from my surgery. My wife and family were incredibly supportive. I got a bit frustrated about trying to get my wife to get me out of the hospital. It was just really rough. Emotional. Again, the nights are terrible, but, just getting 12, 15 shots a day, blood work and stuff. But this Chyle leak was serious. It had to be taken care of. And it was a combination of the doctors doing their thing and me healing. And I was the one being not cooperative. But I healed and I'm home. I've been home for a week now. I'm still on a low-fat diet, and I'm taking shots at home now. I think 4 more days, and then hopefully things will continue. One of the downsides is through all these surgeries, I wasn't able to do the neck exercises like I'm supposed to be able to. So my neck's a little more stiff than I'd like, but I'm going to continue to do those, looking to see if I need physical therapy. But other than that, I feel pretty good. So going back in the office a few days next week, and hopefully on to bigger and better things. So that's the story on my colleague. Hopefully, if you're watching this and you have one, you don't have to go through the 2 extra surgeries I did. But if you do, just know that it will resolve. Talk to you soon. Bye-bye.